At a time when we are all focused on our health and the health of those around us, we often go looking for ways to keep our immune systems as strong as possible because prevention is always better than the cure. Today's guest is a world renowned natural health expert, a best selling author, and is the founder and CEO of Global Healing, one of the largest independent organic and natural health resources in the world. Dr. Ed Group. Dr. Group, thank you so much for making the time to sit with me.
It's always a pleasure. Thank you so much for having me on.
Now, I wanted to start just so that our viewers have a better understanding of who you are if they haven't heard of you already. So, can you give me a bit of your background, how you got to this place in life?
So my journey started around 1995 when I was asked to be on a research team. And mind you, in 1995, they didn't have the internet really available, so you couldn't do research. But there was this guy who was heading up this research program to identify what the root cause of cancer was. This was back when MD Anderson and the big cancer hospitals were bringing in their CAM programs, or allegedly where they wanted to figure out any type of complementary alternative medicine that they could bring in and use with chemotherapy. We found out later that was just a big hoax.
With all of the toxicity that exists in our world, internally, externally, no matter which way it's coming to us, the last couple of years, almost three really, which blows my mind, we have faced a battle which we were told stay home, don't move, in order to stay healthy. Whereas when you're going down a natural sort of healing path, we're told to stay active and make sure we're taking our vitamins, vitamin C, vitamin D, all of these things to boost our immune system and keep us healthy. What was somebody like you thinking over the last few years, watching doctors and our politicians say, stay at home and don't go out?
Well, spending the last 25 years or so looking at all these chemicals and looking at all these toxins and looking at the social programming and looking at the propaganda and looking at the lies and looking at the deceptions and going deep down into rabbit holes. I mean, you can pick GMO foods, you can pick 5G electromagnetic frequencies, gluten, you can look into table salt. You can, all of these chemicals and all these things that we've identified, they all lead down, especially like fluoride, for example, that they put in the water, and even mercury fillings. I mean, there's so many different things.
Just going back to being on the COVID task force, were any of the recommendations that you put forward actioned by the government or the people that you were sending those recommendations through to?
No. We were on the phone with the White House, and early on, we had submitted research, 17-page paper on iodine, especially because iodine is so effective as an antimicrobial.
Coming back to people sort of taking control of their own health, how important is it in your mind for people to take supplements? And is it something that everybody should be doing? Is it something that only a portion of the population should be doing? Because so often on the current affair programs on mainstream media, when they do stories about supplements, the takeaway is you're spending a lot of money and you're peeing it all out and you're really getting minimal benefit for the money that you're spending. And then through the last few years, at first when people were talking about vitamin C, vitamin D especially, they were told, no, don't take it. It's a waste of your money. It's not doing anything. It's giving you a false sense of security. And then Dr. Fauci was doing an interview, I think with Jennifer Garner, of all people, and she talked about her supplements, and he admitted that he takes vitamin D every single day. So there is this sort of back and forth where they sort of speak out of both sides of their mouth.
It's been an ongoing issue for quite some time now, and over the last 10 years, especially, big pharma has been coming in and buying lots of the dietary supplement companies and nutraceutical companies. And I can remember talking to a guy that was a high-level individual at a pharmaceutical company 15, 20 years ago. And he told me, he said, don't think that big pharma doesn't know about every single dietary supplement company. He said, it's already in our plan. As soon as dietary supplements in the nutraceutical industry takes off, we already have it in our plan to buy them. They want to own both, and they are starting to own both because they know that the people out there do get results with good supplements.
You talked about your company, and when I was doing the prep for all of this, I was reading about the process that your company goes through, and there was a lot of information about how everything that you make is manufactured in glass, and even the stone scrapers that you have been specially made so that there's no metal in the process of making everything. And then there was also the fact that there is no palm oil in the products, which for me is a huge thing, because in Australia, I was working with several organizations fighting against palm oil and the destruction to the environment with all of the illegal palm oil plantations. And that's a whole separate thing. But so that led me to two questions. Why is glass so important, and keeping, I can imagine why plastic is no good, but why is glass so far superior over metals? And then why is it important for you not to have palm oil in your products?
Well, so I'm kind of what you would call a crazy mad scientist when it comes to quality, because I want to be able to take it. And this started 20 years ago. I never intended to create a supplement company. My job was we had a cancer clinic and degenerative disease clinic, and my focus was teaching people the root cause of disease, how to heal themselves, because the true definition of a doctor, in my opinion, is a teacher, not a prescriber. However, we became one of the most successful clinics worldwide in 2 years, and the royal family, we had athletes, movie stars, everybody was coming to us for treatment for all different types of conditions. And it only took 2 years before we got rated by the FDA and shut down. And back then, 20-something years ago, there was still lots of chemicals and fillers and excipients and all kinds of crap in natural supplements.
On social media, I have ended up, especially on TikTok, down the natural remedies rabbit hole, and it has been fascinating to watch. So I wanted to run some of these theories and things by you and just see what your opinion is on them. So people have been discussing at length the healing properties of onions, specifically red and brown onions versus white. And they talk about the myriad of ways that the onions can be used to heal, whether it be onion water, the onion pot, pulling toxins out of the air. They are talking about things that can be done with potatoes. So putting potatoes in your sock when you go to sleep at night to pull toxins out if you're congested and have a fever. And then there is all the talk about oil of oregano. So the first question is, do these things actually have merit, or is it all just an old wives' tale?
So everything has merit, and there's thousands and thousands of different, grandma's cures and this out there. But the point that I like to talk to people about the most is, if you're trying to use the onions, or if you're doing the potatoes, or if you're doing oregano oil, or if you're doing any of that stuff, those are all great. But the real issue is, what are you using those things for, and why did you get to that point to begin with?
The next subject is something that a lot of people struggle to wrap their head around. And it was certainly something that when I first met you, we started talking about, and I had to go away and think about it. With this being said, I know a lot of people that do this practice and they've spoken to me about it before. And so I wanted to learn, and I've gone down a rabbit hole, but I have so many questions. And so I am talking about urotherapy or urine therapy, which is drinking one's own urine. So, first of all, how did you get started with this practice?
Well, just to set the stage with everybody right now, we've all been taught, again, you have to just assume that you've been fed so many lies and deceptions in your life. And also assume that God would not create the perfect body without also creating the perfect solution or the perfect medicine. And let me just say that even though we are talking about drinking your own urine, that everybody listening to this has already drank their own urine, because you drink your mom's urine when you're in the amniotic sac until your kidneys develop around 3 to 4 months, and then you start drinking and floating in your own urine. So it's not something woo-woo, and it's not something gross, and it's not something you haven't done before. Every single person has drank their own urine.
When I was reading about this and listening to all the interviews and everything like that, there were articles that I was reading specifically about you, and you were attacked and maligned in a way that's quite incredible. One of the things that I read was that urotherapy is just a right-wing conspiracy. I mean, is that even close to being true? Is it only the right-wing people that are adopting this protocol?
Well, if you look at any information that's been put out into the public, it's, I don't like to say right wing, left wing, but that's the way they do things to try to create hate between us.
I was reading a lot of articles on this, and I found it really interesting. There are positive articles which support this therapy, and then there are obviously the articles which talk about it all being really bad for you, and that it would harm us. So I just wanted to touch on some of the articles that I found. So health.com had a headline, "Why Urine Therapy is Dangerous," bottom line. And at the conclusion of the article, it said the bottom line is don't do it until there is sufficient evidence to prove its benefits. So they didn't prove that it was dangerous at all. There were no links or anything like that. And in every article that I read, I went to every link that they had attached to the article, and majority of them didn't link anything. The National Library of Medicine had 3 articles that I could find on the subject, none of which concluded or linked any studies proving harm. The print.in, which is an Indian newspaper, brought up something that you've already touched on about how Indians are opting for urine therapy to treat cancer and cure COVID. And that was in April of 2022, the article was published. And in it, they were comparing drinking your own to drinking a cow's urine, which I found fascinating because that was the first time I'd heard that. My mind. And then there was another article, and I haven't noted down where it's from, saying that urotherapy has been widely debunked by the press and has not been approved by the FDA or the CDC. Is urotherapy something that the FDA or CDC would ever have jurisdiction over, considering it comes from a person's own body?
All of those organizations, you follow the money. They're all supported by big pharma.
I want to finish because we are running out of time. We've gone so far over what we had initially talked about. How does somebody start this practice? How do they get over the mental block? What is it they have to do to be able to get the benefits if it's something they want to explore?
Well, I always recommend they just start slow. I mean, first you have to read about it. You have to watch the videos about it, and you have to understand it, because that's really with everything, right? I mean, I'm not going to rewire my house unless I study electricity. And it just, especially with the urotherapy, developing and understanding and getting excited about how powerful this really is